New Providence has been categorized as the epicenter of COVID-19 infections in the Bahamas. Health and Wellness Minister Dr. Michael Darville making that declaration on Wednesday as health officials warned of the potential impact of the Omicron variant.
Over the past week, we have seen our daily cases climb from 26 on December the 20th to 159 cases in December the 27th, with 149 cases in New Providence, 5 in Grand Bahama, 2 in Exuma, and 1 in Abaco. This clearly shows that the epicenter of this virus is in New Providence.
Even though the Ministry of Health is still awaiting results of samples sent to a South American lab, Dr. Darville says the rapid rise in cases is also a strong indicator that the Omicron variant has reached Bahamian shores. While there were no new restrictions announced, he and other MOH officials did paint a sobering picture of a country in the middle of a fourth wave. Acting Chief Medical Officer Dr. Philip Swan says new data has confirmed who and what is driving the fourth wave.
This fourth wave has started among a slightly younger demographic, those aged 20 to 29, with the older population being less impacted at the moment. There is a variation in the sex distribution, with 53% of the cases in the fourth wave being represented by females. Where are the cases? Once again, predominantly the majority of cases are being reported in New Providence. There are other islands that Minnesota mentioned earlier where cases exist but at lower rates. And also what is noted is that a significant amount of the spread is occurring in home settings and in the workplace. Both suggest that persons are out and about, not adhering to recommended protective measures, and taking the virus home to their families.
Dr. Darville says one of the most pressing issues facing the country is the shortage of doctors, nurses, and support staff, and the fast spread of COVID across the country in the last week is exacerbating the issue by forcing hospital and clinic staff into quarantine.
We know that there are about 25 staff out in our community clinics, at least 25 to 28 in total. That includes nurses, patient care assistants, clerks, janitresses, and physicians. Again, the numbers add up. Although we have over 91 plus facilities, the numbers add up and cause a challenge as it comes to sustaining services across the board.
Officials say several wards at Princess Margaret Hospital have also had to be closed in recent days, presumably in part due to the high transmissibility of the Omicron variant. However, Darville says the ministry is bringing on additional doctors and nurses in the coming days. The Bahamas recorded 65 additional COVID cases on Tuesday. 50 of those cases were in New Providence. Additionally, 3 more deaths were also confirmed. Since the start of the pandemic, the Bahamas has recorded more than 24,000 cases of COVID-19. Reporting for Guardian News Network, I'm Jasmine Brown.